urging childcare facilities to follow this schedule and plan to reopen on April 1. The Deputy Mayor for Education and the Office of the State Superintendent for Education are also working to identify facilities to be open, childcare facilities that is, for the dependents of essential personnel. We have announced that meal sites will be open for students as well as for seniors across the district during this public health emergency. DPR recreation centers and DC public libraries will also close on March the 16th and reopen on April 1. Additionally, DC Health has updated its recommendation against mass gatherings of 1,000 individuals. That upgrade is DOH is requiring a ban on mass gatherings and lowered the definition of a mass gathering to 250 individuals. There will be some exceptions, and you just follow the DOH guidance. Let me also continue by talking about how we will fund our preparations and the execution of our emergency response. Already, I have directed $7.5 million from the district's contingency cash reserve fund to purchase needed supplies, protective equipment, and other necessary equipment. And we will continue to make these types of investments. I know that residents have additional questions about testing, so let me share some of the high-level facts. To be clear, doctors decide on COVID-19 testing. If an individual is experiencing symptoms, including cough, fever, and shortness of breath, they should consult their doctor before visiting any healthcare facility. If their doctor decides that COVID-19 testing is warranted, the doctor has the ability to take swabs and send them to a private lab for testing. The private lab will share results with the doctor, who will share the results with the individual. The private lab will also alert DC Health of all COVID-19 test results, regardless of if the test is positive or negative. If there are more questions about testing, you may address them to Dr. Nesbitt and Dr. Smith. I want to finish by saying how proud I am of all of our DC government employees. This morning I conducted an all DC government conference call to talk about our modified operations. I'm proud of my administration and managers who are stepping up to the plate to make sure that we can adjust our operations during these unprecedented times. I'm also very grateful for the cooperation of the Council of the District of Columbia. We have been participating in weekly briefings with the Council and working together on a relief package for our businesses and residents. And I look forward to introducing Chairman Mendelson in just a moment. Let me also continue to remind you to keep checking coronavirus.dc.gov, coronavirus.dc.gov for up-to-date information and guidance. So with that, I first want to turn to our schools. And I want to invite Deputy Mayor Paul Kine to just come up for brief introductory remarks. And he may also acknowledge any public charter school leaders we have here and introduce our Chancellor of DCPS Public Schools.
Thank you very much, Mayor Bazzer. As the Mayor said, we have announced that starting on Monday, the 16th of March, going through the end of the month, we have moved towards a system where our schools will not have students in them, but we will have remote learning opportunities for all our children. And let's be clear, we're doing this to ensure the safety of our children and of the staff within our schools. And it is important that families understand that because children are not in school and their students are not in school, they should also not be congregating elsewhere. We are doing this to encourage the social distancing that is imperative as part of our mitigation strategies. DCPS schools, in close cooperation and collaboration with the Public Charter School Board and all of our charter LEAs, are shifting to this distance learning posture. And my office and the Charter School Board, as well as the DCPS Central Administration, are working now tirelessly to provide resources to schools to ensure that their distance learning activities will be successful and that learning will continue for students. We are joined here today by Chancellor Louis Farabee, and he will now share a few remarks about what DCPS is doing specifically to ensure the continuation of services for students during this time.
Thank you, Mayor. Thank you, Deputy Mayor. At this time, DC Public Schools has communicated to our employees our plan for their modified work assignments for the time period that we will not have students in our building for school. It's important to note that beginning Monday, March 16th, we'll have no school for students until March 31st. On the 16th, we'll continue with our professional development day that has been planned for staff, which will include staff preparing for remote learning, but also assigning devices to teachers that currently don't have devices at home so they can continue the learning process with students. As it relates to the remote learning process, students will have access and families will have access to a website which will include grade level content and content areas, for example, for English language arts, mathematics, and at the high school level, it will include all of our courses required for graduation. Students will have the ability to receive assignments, submit assignments, and also receive feedback on their assignments. And educators will also host office hours in which students can communicate with educators, and also educators can communicate with families as well. During the period where students are out of school, we've communicated also that there will be meals provided to students. We've identified sites for our families across the district. We'll include that would be for all students in the district, and we've added additional sites to ensure that we touch all of our students that may need access to meals while we're out of school. Thank you.
Thank you. Thank you to our public education team. I also want to ask the city administrator for the district, Rashad Young, to come up to update us on the district's teleworking process.
Thank you, Mayor. This morning we sent guidance to all of our agencies around our telework posture. Approximately 53% of the district workforce will be teleworking beginning next week. We have contingency plans and operational plans in place to try to limit the amount of public interaction that is required for our agencies that have to maintain an operational posture. Some agencies will have 100% telework. Other agencies will be adopting a modified telework schedule, which means some of their employees will have to come in because they perform essential services. Others will be able to telework. And some of our agencies, primarily our public safety agencies and public works related agencies, will not telework because all of their employees are deemed essential. We've sent that guidance to our agencies this morning. Agency directors are further speaking to their specific work units and employees today to specifically talk about their operational posture if they are to telework or if they have to come into a public facility to maintain critical operations. We will update our telework guidance as appropriate, but we expect those employees to begin that new telework duty beginning on Monday, March the 16th.
I also want to acknowledge Dr. LaQuandra Nesbitt, also Dr. Chris Rodriguez, who is the director of the district's HCMA. We are in a building that is also very close to the Department of Health's headquarters and their Emergency Operations Center that has been stood up by HCMA. This is likely a room that we will use for other briefings as necessary. So I want to ask Dr. Nesbitt to come give us an update on updated DOH orders, and she will be followed by Dr. Jennifer Smith to talk about our public health lab.
Thank you, Madam Mayor. Today we have gone through the process of establishing emergency rules to proceed through the process regarding mass gatherings. Earlier this week, we made a recommendation that all mass gatherings that were non-essential in the district, including conferences and conventions, would be canceled or postponed. Today, we are establishing emergency rules that calls for a ban on all mass gatherings of 250 or more individuals, and for individuals that for gatherings that are intended for individuals who are part of at-risk populations, that those gatherings would not have more than 10 individuals. These strategies are being put in place as part of our social distancing measures that are part of community mitigation, as Deputy Mayor Kine has mentioned before. It is critically important that individuals recognize, as we implement teleworking policies, as we have school closures in the district, that these are not intended for individuals to not be at work or not be at school, but to congregate in large groups in different places throughout the city. So as we have our mass gatherings ban in the district, we seriously want people to not host events that would have people congregating, increasing opportunities for the transmission of coronavirus. This mass gathering policy does not apply to schools, workplaces, or healthcare facilities, or residential buildings. So that's some of the things that we want people to understand. And we will have these regulations published in the DC Register for further review.
Dr. Smith?
Good afternoon. I'm Dr. Jennifer Smith from the Department of Forensic Sciences, the Public Health Laboratory. To date, as of this time, we have not gathered any more or tested any more positive cases, so we still remained at 10 positive cases. We have done additional testing. We now have 49 negative cases, and we have 10 cases that are pending. So we have a total of 69. We will begin to post these results, and we will also obtain from DC Health any additional results that are coming from outside labs, and those will be done throughout the day and posted by the end of the day.
I'd like now to introduce Council Chairman Phil Mendelson. We just wrapped with a meeting with members of the council and our budget teams to talk about what we've heard from our communities in terms of the relief that would be needed. We recognize that the containment measures that we're putting in place are having a very significant impact on our economy, on our nonprofits, on our churches, and on our restaurants and hotels and our business community at large. And so I want to introduce Council Chairman Mendelson to represent the council.
Thank you, Mayor Bowser, and good afternoon to everyone. The council has a scheduled committee of the whole meeting next Tuesday, and we will have an additional legislative meeting at that time. And at that meeting, we will have a bill. It's called an emergency bill because it goes into effect immediately without congressional review, and it is also in effect for 90 days. And it will address proposals to mitigate the consequences of this pandemic as so far we have identified proposals. It also will expressly authorize that this public health emergency can remain in place for 45 days, so the mayor will not need to come back to the council for any extension of time within that 45 days. As the mayor indicated, the executive, meaning the mayor and her senior staff and the council, have been working together. In fact, the meeting we had this afternoon included the chief financial officer as well, as we were working through different proposals. We are looking at what kind of relief we can provide to businesses. We're looking at tax deferrals, which are in essence an interest-free loan to businesses so that they do not have liquidity problems within the next couple of months. We are also looking at measures that will provide some relief to individuals, and in particular we're looking at where there are license renewals, for instance individuals who need to renew their participation to the Healthcare Alliance, that there will be a tolling. I think that's what we're looking at, a tolling or extension of time, so folks don't have to think about how they have to get in line and with a whole lot of other folks and worry about the renewals. We're looking at this as broadly as we can. There also will be provisions, the mayor and I and others talked about this afternoon, to ensure that evictions are not actually carried out during this public health emergency, or utility disconnections. So those are some of the proposals that we are looking at. A draft of the bill was circulated yesterday and is available on the council's website. It is being revised, and there are some provisions that are being added to it. I don't know whether we will be posting it again before Monday, but we will be trying to make sure it's available to the public before the meeting on Tuesday. Thank you. And I neglected to note that Kenyon McDuffie, the Chair Pro Tem and Councilmember from Ward 5, is here as well. Thank you.
I also want to acknowledge and thank Rosie Allen Herring for being here, who is the CEO of the United Way. We gave Rosie a call because we had heard from another number of church communities, nonprofits, who are going to be hard hit during this time as well. I know that a number of our faith congregations have heeded DOH's advisory and have canceled services. Some of them will work with the United Way for their parishioners and their congregants who want to continue to be active with them. So thank you, Rosie, for making your service available. Okay, so with that, we will take on-topic questions. Yes, Sam?
So, Mayor, it seems that basically, except for those three agencies that you mentioned, there really will be no face-to-face contact between DC government employees and the public. Is that
I didn't mention three agencies.
You talked about the police, the fire, and DPW, as I recall.
Oh, no, there are a number of agencies and parts of agencies where employees will continue to report to work.
Mayor Bowser?
I don't have it off the top of my head, but we can provide you with that. So where it is, Sam, is that we have three categories. There are some agencies that we think can very nearly 100% telework. Others that portions of their workforce can telework and others cannot. Those are the kind of the modified telework group. And then there are agencies who are not eligible for telework. I think those must be the agencies you just referred to.
That's what I was talking about.
Yes.
What about, for example, license renewals? I heard the chairman mention that. Like DMV, places like that, because let's say your tag expires.
Right, and so what we're working on right now is for each of the agencies, and I'll ask the CA to come up and answer more specific questions. We'll be noting on their websites how their operations have changed. So we're asking people before they even try to go to call or look on the website so you know exactly how your operations have changed. Where possible. If there are due dates during these emergencies, we'll try to extend them where possible. It may not always be possible, and frankly, we're still looking through that. So we need people, if they have business with the district that has a due date, to make sure they're calling ahead, checking the website, so that we can give you the correct response.
Mayor Bowser,
Yes.
is the ban on mass gatherings now mandatory?
It is.
And so so are there penalties, or how is that enforced?
Let me ask Dr. Nesbitt to come up. It did require us to promulgate a rule.
So during an emergency or public health emergency, there can be penalties associated for violation of any of the orders that are deemed necessary to protect the public's health and to ensure that order is restored.
Yes.
When you say no more than 10 people from at-risk populations, what's considered an at-risk population?
Individuals over 60, individuals with chronic medical conditions, and individuals who are considered to be immunocompromised.
How does that affect senior centers?
So we have been working very closely with our organizations who provide services to seniors in our Department of Aging and Community Living to suspend and recess their senior activities during this time, without the compromise of feeding programs.
Yes.
For you, Ms. Mayor.
Yes.
Are the daycare facilities and the daycare centers run by the city closing?
Well, the city doesn't run any daycare centers at this stage. We have some daycare centers in our buildings, but they're run by private operators. And we are recommending that at large, that daycare centers also close following what we've decided for DC public schools. However, and there's a big however, The big however is I've asked the deputy mayor and OSSI to come up with a program to recruit providers who will stay open during this time, especially around our hospital sites for our employees and not just our employees, but employees that cannot telework and have to be at work to do their jobs. So our employees that have been mentioned, but also all the medical staff that are keeping our hospitals running. So that is, that information will be updated. We are working on it and we need to identify how many slots we really need, what the demand is, and how we can help providers think through it. Yes.
Hi. So every doctor in the city will have the ability to send swabs to a private lab. Is that how this is going to work? And then also, is this information going to be on the government website once you have all of the results from private labs? And how many are there?
Yes, let me ask Dr. Nesbitt or Dr. Smith to address that.
So currently, and this is evolving, there are a lot of announcements of labs coming online, but we know of at least 2 major laboratories that are accepting samples right now. We are going to track those results. They do have to be provided to DC Health, and we will be tracking and compiling those throughout the day and posting those in the evenings.
And I think many of you heard the president's announcement a little bit earlier. We don't know any more than you know at this stage about the more testing that the federal government will be rolling out at retail locations. He said that we would get more information about that in the coming days. Yes. Oh, you've asked. Let me get somebody else, Sam. I'll come back to you. Yes.
For daycares, will parents who receive vouchers, will those vouchers continue to pay for daycares, and daycares that are receiving subsidies, will those subsidies continue to trickle in? And would you, if daycares want to remain open, would you use your quarantine powers or whatever powers you have to ensure that they don't stay open?
As I said earlier, Perry, we recognize that we still need daycares to function, some of them, not all of them. And so we are working on the slots that we think we need. Not only will we allow them to stay open, we're going to encourage them to stay open.
And for the subsidies?
I think that, yes.
All
Yes, the subsidy will continue.
Okay. And for Childcare therapy, you mentioned that kids would receive, an online website. What if students do not have access to that website? I understand while a lot of kids have access to internet, maybe they don't have enough reliable internet to go as far as submitting kind of paperwork and things like that.
Thank you, Perry, for that question. So beginning next week, families and students will have access to their schools to come pick up hard materials. So if they want a hard copy of the learning packets or tasks associated with the distance learning period, they can come to the schools. We will share with families the times that they can come and receive those materials. It's also important to note that many of our students left their campuses today with their consumable materials, their textbooks, any other literature that they would need during this time period to support learning. And so with those materials that they left with today, coupled with what will be posted online and what families can pick up at schools, we believe that provides adequate resources for students to continue learning.
Will teachers be checking in with students?
Yes, teachers will be checking in with students. Once our teachers have had opportunity to have time with the site and the materials, we will then make that available to the public, which will be organized by grade level and by content area.
But they'll be calling students during I know some charters mentioned this, I don't know if that's right.
Yeah, so we will post office hours for each school. So each school has a communication channel in which they will communicate to their families of how to contact educators. And with the office hours, we provided technology solutions for our educators to communicate directly with students.
Mark.
So, and I don't mean to be smart ass about this question, but you're talking about social distancing, you're talking about banning groups. Does this meeting, do these press conferences comport to best practices? I'm guessing that there's a lot of non-essential people in this room right now who don't need to be here. I'm betting I can count 10 people over 60 in this room, and I'm just wondering, I'm just wondering if we are practicing best practices.
Actually, we thought about that. So we're practicing one best practice because ideally I would like to be having this press conference in the Emergency Operations Center. We decided not to let you in our Emergency Operations Center in case you infect any of our essential personnel. Some of them are here. And that's a serious issue because something like that could wipe out our whole public emergency response. And so you ask a serious question. I have asked my team to think of alternate ways that if we needed to clear the press room, we could still make our statements and you could still ask your questions. So that is in development. Yes.
I was talking to charter school today, I guess it's for Dr. Farabee. I was talking to charter school today. They were saying that next week is spring break, and then the following week they begin learning. Is that how it works with DCPS? Or?
Yeah, so what you're describing is the DCPS plan. So beginning on Tuesday, March 17th, we will go into our spring break period, which was previously in April. After the 5-day break for spring break, the following Tuesday we'll begin the distance learning process. And part of that is to ensure that our educators have ample time and preparation for the distance learning period, and also to ensure that we have communicated with all